Good morning, everyone. I'm Steve.
And I'm Scott.
And together we are Backyard Musings broadcasting Apple Valley, the Science and Technology channel.
Yep.
Got an interesting cancer story for you on the heels of what we talked about a couple of days ago. Innovative therapies and surgical techniques have the potential to transform liver cancer care. People with cirrhosis, a condition where healthy liver tissue is replaced by scar tissue, have an increased risk of developing liver cancer. This scarring disrupts blood flow and impairs liver function. Patients with advanced liver cancer and cirrhosis are typically not considered candidates for surgery or transplantation. However, a new study published in the British Journal of Surgery reports a successful case in which a patient previously deemed ineligible for surgery underwent tumor removal after receiving immunotherapy. That's what we talked about earlier.
Yep.
And targeted radiation therapy. Would you like to know more?
This is a quote. Our study describes how a minimally invasive surgical approach known as the Arantitis first technique can be applied in high-risk populations, potentially expanding surgical indications for patients with cirrhosis. This is explained by corresponding author Eduardo Vega, MD, assistant professor of surgery at Boston University, Chobanian and Avedisian School of Medicine.
We know some Avedisians
Yeah,
out
spelled
here.
a little different, an extra S in there, but this is pretty close. The Arantitis first technique is a laparoscopic procedure that uses the Arantitis ligament as an anatomical landmark to quickly expose the middle hepatic vein.
So all of our doctoral students out there will know what the middle hepatic vein is.
I hope so.
Yeah. This method allows the surgeon to quickly and accurately locate the MHV, one of the liver's major vessels. In conventional approaches, there is a higher risk of split injuries or iatrogenic damage to the MHV, which can lead to severe complications, particularly in patients with cirrhosis who have limited functional liver reserve. By focusing on this landmark, the Arantitis first technique minimizes the risk of injuring the MHV and ensures its preservation, which is critical during a left hepatectomy. What?
Sounds good.
I'm going to sound it out. Hepatectomy in cirrhotic patients. This precision not only enhances the safety of the procedure, but also contributes to better patient outcomes.
The patient's care involved in multiple steps. This patient's care involved multiple steps. First, the tumor was treated with TARE, a targeted radiation therapy that reduces tumor size while sparing healthy liver tissue. That sounds good. New immunotherapy was used to boost the immune system's ability to fight the cancer. Okay, that sounds like two positives.
Yeah, these combined treatments transform the tumor from unresectable to resectable. Finally, laparoscopic surgery was performed using the Arantitis first technique, which allowed for precise tumor removal while minimizing harm to the remaining liver. According to the researchers, this study highlights the importance of collaboration across disciplines with surgeons, oncologists, and radiologists working together to achieve exceptional outcomes. We like that.
We like that, yeah. Because we've talked about the opposite of that, right? Where people just don't communicate.
So. Yeah, in a bottle.
Yep. Laparoscopic surgery, also referred to as minimally invasive surgery or laparoscopy, is a surgical technique in which a thin camera-equipped surgical device is inserted into the abdomen or pelvis through one or more small incisions. The camera relays a real-time video of the internal organs on a monitor for surgical guidance, and the operation is done through the small incisions.
Yeah, Shersty got this had her gallbladder removed. She got that.
I've heard of people doing this for knees too, I think. Maybe not exactly like this, but like very small incision. They go in, they either scrape or sand or whatever, but they can see what they're doing. So it's cool. Some problems can be repaired with this technique, and certain conditions can lead to serious complications if such an operation is done without success for a quick repair. So
once you go in, you got to know that you can fix it, because you can't repair it that quickly.
Yeah. So, and we know that cirrhosis of the liver is usually kind of stigmatized as somebody who's been maybe drinking a lot or an alcoholic, but we know somebody very well, at least I know him very well. You may know of him if I said his name. Just had an issue with that where he had cirrhosis of the liver. And he's doing very well. I'm not exactly sure what the treatment was, but he's doing really very well. But he is not a drinker, so yeah,
It can happen. Yeah.
it can happen. So yeah, so this is but this is promising stuff. Very promising. We like these stories.
Yeah, it's they're pushing the envelope for cancer, and it's not just necessarily medicine; it's techniques and procedures.
Right.
Yeah.
Exactly.
All right, folks. Thanks for joining us. We'll catch you in the afternoon.
Take care, everyone. Thanks.